Hi, this is Dr. Homer Lim, and you're listening to your Holistic Health Podcast.
Good afternoon, guys. Welcome to again our weekly talk here at Akesis Holistic Health. This is Dr. Homer Lim. We will actually be talking about vaccination and ivermectin. So Miss Everly Delmo is asking how is it to take ivermectin for prevention? Okay. Now before ivermectin was actually suggested or as recommended by the FLCCC, which was once every 2 weeks. But because of the surge, we have switched it to one capsule every week if you are less than 80 kilograms. If you're more than 80 kilograms, then you have to take more. But now with this Delta variant, we really have to compute it based on weight. So if your weight, we have to base it on your weight. So if your weight is around 60 kilograms, the dose now is zero point 0.4 milligrams per kilogram, right? So if you're 60, that's around 24 milligrams. So that's how we take ivermectin. So at least once a week. If you go out every day, then you really have to take it at least twice a week because that's already the new guideline of FLCCC, taking your ivermectin twice a week, either Monday or Thursday or Tuesday or Friday to avoid getting infected. So again, you have to base it on weight, zero point 0.2 to zero point 0.4 milligram per kilogram body. From Reno Genesis, no, CNN warns the use of against the use of anti-parasitic drugs for COVID-19 and calls to poison control centers. How true is this? Yes, it is true that the US CDC had warned against the use of ivermectin. The reason for this is because a lot of people in the United States, they could not get ivermectin prescription. Okay, so what the people did was they buy veterinary grade ivermectin. Okay, so of course the veterinary grade ivermectin, especially for horses, for cows, no, are very high in amounts, no. So usually nasa 5 grams, no, 10 grams per pack, no. Some people they take one whole pack, so of course they will develop overdose, no? So therefore the lesson of the day: do not use veterinary grade ivermectin. Okay, so from our Trinidad, with regards to IVM, they never went out since the lockdown, as in stayed at home until now. Ano ma-recommend yung intake of ivermectin? Okay, so if you're not going out of the house, no, and you make sure that everything that you get outside, clean it properly, no, then you can take maybe ivermectin once every 2 weeks. So if because you don't really go out, so if you know that your chances of getting COVID then would be lesser. The only reason you get COVID, you get some package from outside, or you have somebody in your household who goes out to buy, groceries or goes to the market or to buy stuff, and then they get infected. Then everybody at home get infected. But if you're not going out of the house, chances of you getting COVID is actually very low. Okay. So from Vilma Cheng, her mom just got discharged from the hospital due to COVID. Will she need to take ivermectin because she has CLL, which is chronic lymphocytic leukemia? No. Okay. For your mom, if your mom already had COVID, that means your mom has got cured of COVID. That means that she would have some form of antibodies forming, or your mom's blood cells or immune cells are actually producing antibodies against the COVID. Then I don't really recommend to take ivermectin because she already has some antibodies. Okay, so I really don't recommend unless you check their antibodies and their antibodies are low or net zero, no, then you can continue taking ivermectin is as prophylaxis. Okay, and then she's asking, so I think her question was because of her mom having COVID and they were actually also infected and they were taking some antibiotics and Chinese medicine. She's thinking that maybe she's the carrier while that's why they all got infected. So again, as I saw from the previous question, if you go out, okay, you might get infected, and even though your people at home do not go out, if you do go out, you have to make sure that when you come home, you take a bath as well as do your oral hygiene, as what we said in the I Protect 2.0 protocol. Before you go out, you gargle with either povidone iodine or your hydrogen peroxide, gargle or nasal spray. Before you come into the house, you do that again so that to prevent you from getting infected. Okay? So I think that's one thing you have to remember. If you're going out of the house, you have to make sure that you do your oral and nasal hygiene too. Okay. Okay. Joseph is asking, can I resume taking ivermectin within 2 weeks interval after vaccination? Yes, you may continue. Again, please be reminded, everyone, that even though you have taken a vaccine, does not protect you from the Delta variant. We have seen this data now coming out from UK, Israel, even the United States, and even here shows us that the vaccines right now are what we call non-sterilizing, or what we call leaky vaccines, because these vaccines do not prevent you from getting infected, do not prevent you from infecting others, and do not prevent you from having a disease. So it's important for us to realize that these vaccines are actually leaky. So you have to take your ivermectin if you want to prevent from getting COVID. Okay. So I guess that question would be, why then we are doing this vaccination if they're leaky in the first place? So time to ask our authorities what's really going on. Okay. So there's a question. Sally Ong, she was vaccinated August 11 for the second dose. Then she had fever on August 15. Kailan pwede mag-take ivermectin, and for how long? 8:15. So more 12 days na. The question was 12 days ago. So very important for you to realize, and a lot of people actually have this problem. We've been seeing a lot of patients who have been vaccinated. No, the only problem is your vaccine will only give you protection if it does give you protection, would be the second week after your second dose. Okay, so let me repeat. These vaccines, if they would really prevent you from getting COVID or having a severe disease, would really happen the second week after the second dose, not the first dose, second dose. So like this Miss Sally, wherein she got vaccinated for the second dose, and then she had fever on 15, and she's afraid that she might get COVID. This is what we've been seeing a lot now. A lot of people actually are infected, or they get infected because dun sa facility, siguro yung katabi nila, nagka-COVID, or naging mayabang sila, or vaccinated na ako, I won't get infected. And we're seeing a lot of people na, they haven't been, their body has not had that immune protection yet. No, they go out and they get infected. So it's really very important to understand that your vaccine is not instantaneous on effect. Number two, it does not, again, not these vaccines do not completely protect you from getting infected and infecting others. So you really have to take your medicines, no? So if you do have fever, body pain, cough within that, whether or not you've been vaccinated or not, you really have to make sure that you have yourself checked, because you really might have had the COVID, which is what we've been seeing quite a lot now with this current surge that we have. Okay, Miss Demi Comia, she's thalassaemic. So she said, is there holistic procedures to manage beta thalassemia minor with non-transfusion dependent iron overload? Okay, so she's asking the question for her, because a lot of people who have thalassemia would have iron overload, no? So are there any other way to lower your iron levels without doing what we call, yung nagba-bloodletting sila to release more iron, no? So actually, because of your thalassemia, no, yung may error of making your hemoglobin, tawag natin, or red blood cells, so madaling masira. So your body is trying to recycle the abnormal, no, or defective red blood cells. So kaya nagkakaroon tayo ng iron overload. Are there any other way to manage this? There are what we call herbal, tawag natin, chelators, which chelate iron, but they're not as powerful as actual chelators, no? But you can try taking cilantro, because this is a very good chelator. You can use alpha lipoic acid, also vitamin C. These are weak chelators of iron, no? So that's what I can recommend as opposed to doing bloodletting. Okay. So Mr. Bogart is asking, can you take prophylaxis even though meron silang Parkinson? Okay, and macular hole. Yes. So the only, again, for those who are not aware, no, so ivermectin is contraindicated in patients with cirrhosis, liver cirrhosis, no. Okay. May masasuggest from Mateo, parang ang daming may thalassemia. Well, anong diet meal plan for thalassemic patients? Of course, for thalassemic patients, we really have to avoid too much meat kasi iron. So that's what we really have to put. Okay? For Miss Isa Garcia, she's asking for a prescription, no? Actually, from Sin Chan, are there instances that one can take IVM prophylaxis and still get infected? Of course, no drug is 100%. Okay, the most important thing when you're going to take ivermectin as prophylaxis, you have to take in your body weight based on body weight. Okay, so that's very, very important. There's no drug or devices that will give you 100% protection from COVID. Okay, so does not mean that you're taking ivermectin prophylaxis. That doesn't mean that you should be careless in how you should protect yourself. Okay, so does garlic oil have quercetin? It might, but it's not as much because ivermectin, I mean quercetin, garlic oil. She's asking, is does garlic oil have quercetin? It might, but not so much because quercetin is not fat soluble, no? So as compared to garlic oil, it's an oil, so it's fat based, no? Okay, Miss Elaine Serrano, they have COVID patients cannot sleep. What to do pag walang melatonin? Okay, very good question. So if you have COVID positive patients or family and friends who cannot sleep kasi wala ring, and again, di sila makatulog, it's not because they have lack in melatonin. It's rather, number one is because they're number one uncomfortable. Number two, maybe because they're coughing a lot. So that's why they cannot sleep. So I would suggest if you don't have melatonin available, you cannot sleep. You might take some antihistamine like your diphenhydramine or something like yung mga antitussives natin, no? Like dextromethorphan. This would help also in calming the cough, no? So you could sleep better. Okay? So Miss Garcia Isa is asking if nagkalagnat after vax and the next day pwede na ba siya mag-IVM? Yes, you may take IVM if you have fever, but I wouldn't suggest so because the fever might be due to the vaccine, not because of COVID. Okay? LG is asking if it's possible to get COVID right away that is severe. Okay, now let me tell you something with COVID. You do not get COVID severe at the outset. Most of the time, these patients are in denial that they are sick. Okay, you cannot get COVID outright severe. So most of them would have what we call mild symptoms, a bit of cough, headache, body pain, and then they don't really do anything about it. They put them aside, say, oh, wala yan. And then after 1 week, yan na, they get more and more severe symptoms, no? So you cannot get COVID outright na severe agad. It's more or less, they have symptoms, pero di lang nila pinapansin. Okay? Miss Abby Dulay, she's asking her mother-in-law got vaccinated, J&J, last July 30. She's hypertensive and her BP has been fluctuating between 200 to 160. They have followed the treatment protocol for COVID because she has been having a runny nose and fever. She always feels dizzy after 3 IVMs per day for 2 days. Okay, so a lot of questions here. So yes, some people do develop hypertension after vaccination. Okay, but that doesn't mean that because you have high blood pressure, you're already COVID. Okay, so it could be the vaccine has actually triggered a hypertensive episode, but that doesn't mean that you are already infected with COVID. Okay. However, she said that she has started having runny nose and fever. There, then you have to check if you have COVID. Okay, then you have to be treated properly. Okay. Okay. Very good and important question. I want people to listen to this. This is Lee. Rio is asking, what is the chance of getting COVID within months of having COVID again within months? No, what would be the severity if there's natural immunity and taking IBM? Okay, I want to make an important point here. If you have COVID already, I'm sure you've seen the news na a lot of people, yung mga artista or, prominent people who get COVID not just once, but twice, some even 3 times, no? We have to ask the question muna, why would you have a reinfection in the first place? Maybe you're doing something wrong. Because all these viruses, whether it's COVID, whether it's hepatitis, measles, mumps, rubella, right? Yung chicken pox, no? When you have these infections, your body's immune system produces what we call an immunity or antibodies against it, no? So So the immunity actually is lifelong, and nobody's been the real truth about these the immune effects of COVID. No, nobody's really trying to tell the whole story. No, but in general, no, once you have COVID, you have lifelong immunity. Okay, now there will be people who say that's not true. Well, what is their data? Where is their evidence showing that it's not true? If they have been having recurrent COVID, number one, it could be false positive. Number two, there's something wrong then with their immune system. Why they are not mounting a good immune response against the COVID? So what is the chance of you getting COVID? The papers have shown, and they can quote me, they can look it up, fact check this, okay? Patients who have had COVID, the chances of reinfection is from 6 to 100,000 to 1 in a million. So 6 in 100,000 to 1 in a million. So kung tinamaan ka ulit, yun nga, you're part of the 6 to the 100,000 or 1 in a million. Okay? So there is, of course, a chance of getting reinfected, and it's not true that your immunity will wane after getting COVID. No, that's not true. Okay? If that is true, then with this, the human species would have been dead by now because of the so many viruses in our environment. Remember, we are not only dealing with COVID. Our environment, we have so many hundreds of thousands of viruses. Your gut, yung bituka natin, have so many bacteria, fungus, and virus. If we cannot mount a long-lasting immunity to a certain virus, guess what? Lahat tayo will be dead by 20 and 30, right? So let's use our common sense before we listen to so-called experts who are touting their self-vested interest. Okay, Miss Melai is asking, she's not feeling well. Can I take ivermectin now? Ivermectin is not a vitamin. Okay, so you have to check, see what's have yourself checked before you take ivermectin. It's not a vitamin. Okay, so we have to respect also. These are also drugs. Okay, okay. Can I take prophylactic IBM while taking oil of oregano? Fine, it's no issue. Okay, that's from Miss Leslie Yu. Okay, and then Miss Isa Belayo Garcia is asking, posible ba mag-develop ng pneumonia a week or two after second dose of vax sa elderly? Yes, actually yes. Same Isa is seeing the same thing, no? We do get a lot of people after the second dose of vaccine, whether second or first dose. People have to understand and realize, and you can check me again on this, that within the first 2 weeks of your vaccination, that is why we always tell people, if you've been vaccinated, first 2 weeks, stay at home. Because the papers and data have shown the first 2 weeks after vaccination, your immune system actually dips. You will have lower lymphocyte count that first 2 weeks because your body is trying to mount an immune response against the vaccine. Okay, so the first 2 weeks is really very critical. Avoid going out because you are more prone to getting infected actually. And that is what I've been saying before, no? First 2 weeks after vaccination does not guarantee or it will not give you any protection from the COVID if you got the COVID vaccine. So it's very important for you to know that because the first 2 weeks is really the most critical. If you get COVID vaccine, first 2 weeks, please be aware that you might develop some form of lowered or impaired immunity because again it's mounting a response against the vaccine, so we have to be careful. Okay,
Thank you for listening to your Holistic Health Podcast. This is Dr. Homer Lim. Now, if you do have questions about your health or you would like to request topics for our next podcast, please do message us at our FB page or Instagram at Akesis Holistic Health, or you may visit our website at www.akesisholistic.com. Thank you again, and please do come back for our next episodes.